Everyone here at Scripps is really invested in teaching and they're very passionate about it.
Everybody is very personable and everybody is out there to kind of help guide you through this process.
I chose Scripps because I felt like it would give me a lot of one-on-one attention, which is really important when learning in fellowship and learning about endocrinology.
I think it's even better than what I imagined it was going to be. Everybody is so open to just for you coming in and just asking any question you'd like. There's no dumb question. It's just a very nurturing and great learning environment.
We are a smaller program at Scripps Clinic. We have a total of 2 to 3 fellows. That includes both our first year and second year fellows. What that means is that there is personalized attention paid to each endocrinology fellow.
I love working in endocrinology here because I get to see all different types of pathologies, whether it be just from your normal diabetes to your thyroid nodules to type 1 diabetes to the more exotic kind of things.
Scripps is a more hands-on experience than other programs. I'm able to do thyroid biopsies, I'm able to do thyroid ultrasounds.
You get to interpret CGMs, you get used to all these different insulin pumps, so it's a great place to learn.
The breadth of exposure that they get through their training is second to none. We're not only a clinically oriented fellowship program, in other words, designed to prepare the fellow who wants to go into clinical practice, but we're also a very procedural-laden program as well.
If you come here, you know that you'll have an open door policy with everybody, and you're not only going to be learning from endocrinologists, but you're going to be learning from cardiologists that you consult with, oncology that you consult with.
I've just learned at an accelerated rate because it is a topic that I was so interested in. So every day I see myself researching more, going and looking up articles, looking into patients' histories more because I'm so interested in the topic.
You get to see the whole disease spectrum and you get to see patients from start to finish. You get to kind of build a relationship with these patients.
I love San Diego. I'm an outdoors person, so I love nature, especially whenever I have time off from the hospital. I like to spend most of it outdoors. There's been so many opportunities for that in terms of hiking, going to the beach.
You have 70-degree weather all the time and you just have a different environment, which is great. You can always be outdoors at any time. You can run at the beach before work, you can run at the beach after work. It's just overall great.
Another key facet of our program is our ability to give fellows the opportunity to work in underserved communities as well. It's a very important part of the fellowship process to acknowledge and understand and to be able to work within conditions where there are health disparities.
It's a great place to learn, and you're in San Diego, so you can't really beat that, honestly. And I think as soon as you start working with the attendings, you realize you're at the right place.
I really like the fact that they incorporate learning in a less stressful environment. I really loved meeting all the attendings. Learning has been such a fun process here.
I love to teach, and I love to nurture and grow the next generation of physicians, endocrinologists in particular.